Good afternoon, everyone. Now, I'm sure your hands are a little bit tired at the moment, but I'm gonna have to ask a couple questions before we begin. So, raise your hand if you've heard of the tech giant Google. Basically, everyone makes sense. Now, raise your hand again if you know who the CEO of Google is. Not that many. Now, for those of you who don't know, his name is Sundar Pichai, and he once said, artificial intelligence will have a more profound impact on society than fire, electricity, and the internet. Today, we will be exploring a rapidly emerging topic in the healthcare field of artificial intelligence. My name is Siddhant Mishra.
My name is Matthew Wynn.
I'm Natalie Labatia.
I'm Emily Mejia.
I'm Amelia Kyung.
I'm Shivam Vora.
I'm Prima Gadda.
And our question today is, what are the ethical implications of allowing a neural network to predict a stroke prior to visible symptoms in patients?
Okay, so for some background information, I'll first talk about strokes. Strokes are basically some neurological complications that occur due to either clots in the brain or even bleeding in the brain. These are called ischemic or hemorrhagic strokes. The thing about these strokes is that they can cause both drastic cognitive and social implications, which will completely change the everyday lives of these patients. Secondly, I'll talk about AI in healthcare. AI has been in healthcare for a while, and a lot of their work is in diagnosis, making treatment plans, as well as analyzing scans. And one main idea about this is radiology, in which doctors use AI and they give the AI the scans to analyze, create a diagnosis, and create a personalized treatment plan, which will end up in a better prognosis for the patient. And lastly, neural networks. Neural networks are actually like a subsection of AI in which they try to mimic the brain for more humanly response. And this is actually really beneficial because now we have like it's kind of scary how we won't understand how the AIs do it, but now we have a more humanistic approach to all the answers. And neural networks are actually used in healthcare right now. And one example, which is actually really related to our topic, is that they use neural networks to predict cancers in patients. Using that technology, we can make our idea a reality.
So currently, neural networks are being used to diagnose and treat patients, as you mentioned, but the average neurologist can easily do this himself or herself. And so what if neural networks could then predict strokes in advance? So that is what we are proposing. This technology is already being used with cancer, with cardiovascular disease, and so we hope to implement something similar for strokes. The AI, in this case, an enhanced neural network, in addition to analyzing scans, would collect patient history, like previous data, and significant causes of stroke in the body, such as high cholesterol, high blood pressure, and cases such as atrial fibrillation. Using this information, the artificial intelligence would then be able to predict strokes and also determine an individual's stroke risk. The benefit of this would be that you could potentially reduce the time it takes between having a stroke and getting the treatment for the stroke. Instead of waiting at home for 911, patients can be more proactive and can head to the hospital if an AI suspects like a stroke in the future. This will be very beneficial and will save the lives of like the individuals at risk and everyone else around them.
So as you've heard, the neural networking AI will definitely provide many benefits for the future of medical technology. However, this does not mean that it does not have any drawbacks. The neural networking AI presents an issue regarding exclusion to particular jobs. How is this, you may ask? Well, the neural networking AI relies on predictions, which could lead to something known as false positives. These false positives are basically when the AI misinterprets the patient data and the data it collects actually presents that the patient was positive for strokes when it's not. This could have massive implications on the future of the workforce, as occupations in which customers may be injured if the employee experienced a stroke would result in many less employees, as they would no longer accept high stroke risk applicants. This is not the only issue that is presented from AI. The neural networking AI works by collecting patient data and using that data to more accurately assess whether or not that patient may experience a stroke. This data is collected on what is known as a cloud storage system. And this means that it's accessible within a single area. However, this also means that unauthorized access is more likely. This can present issues regarding HIPAA violations, which is the confidentiality of patients and doctors. And it could lead to trust issues amongst the medical institutions and would also possibly lead to charges against them.
AI technology is extremely expensive. The cost is not only reliant on consumers, but it's also reliant on local hospitals and healthcare healthcare places also implementing these services into their establishments. Ethnic groups that are more prone to having strokes are at a disadvantage because they may not have the financial capacity to cover the cost. This is a major ethical concern because all people who are at risk for strokes deserve equal access to these services to see if they can prevent the strokes in advance.
Going back to our first issue, there is a chance of reducing the false positive rates. Our solution is a diverse data sets, which means going back to our first issue, there is a chance of reducing the false positive rates. Our solution is having diverse data sets, which means having more data. So by accumulating more data, the learning machines have more information to use for the diagnostic and reduce false positives. Now, in terms of job exclusions, we have to realize that the benefits outweighs the cost. So the main benefit of AI productivity, is the potential decrease in fatalities. The decrease in potential fatalities. Which, okay. The main benefit of AI productivity is the potential decrease in fatalities, some of which will have been caused by employees who can have strikes in jobs where many lives can be lost, like pilots. So while the cons like in employment and lack of insurance are significant, they're trivial consider the many lives saved. Our solution for privacy concerns is limiting the use of third parties by installing the neural network AI within hospitals. This will ensure that updated information will go to less sources. Having these institutions in charge of the information will reduce the possibilities of HIPAA policies being violated.
One potential solution to the inaccessibility of AI technologies is government funding. The direct cost to consumers can be reduced if there is support from the US federal government with healthcare-focused policies. So another solution is also insurance coverage. If insurance can cover the cost of AI technologies for patients, then patients will be able to access these preventative services without worrying about the cost, and more people will be able to see if they have the opportunity to prevent a stroke.
As with any theoretical technology, neural networks have their limits. The neural network would look at everyone the exact same, which means it would not take into account the fact that different groups of people may have different health conditions. This would result in approaches which may not be what's best for the patient. Since networks don't exactly take everything into account and just look at everyone the same, it may not include race, gender, age, neurotypicalities, really anything which makes people, in a sense, diverse, which would be necessary in order for stroke predictions. This may result in false negatives. And the issue with false negatives is that it will lead the patient to believe that they aren't at a risk for stroke when they are, which defeats the entire purpose of the network. The final major limitation of neural networks is something which impacts all of AI, which is the black box theory. This theory states that in between the input, which in this case could be a brain scan, and the output, which would be a prediction in this case, is a black box, and we don't know what's going on inside of this box. There could be anything going on, which raises questions about whether the information inside this hypothetical box is really reliable, and it also makes it difficult to resolve issues which may develop internally.
Okay, as for resolutions to these limitations, we can start with ethnic disparity. And so neural networks have the ability to learn and adapt to data. So if we actually input data about these ethnic differences, for example, it could be red blood cells differences, blood pressure differences, or platelets amounts. If we input them into the neural system, they'll be able to actually use and have access to this data. And with this data, they'll be able to influence their decisions that they make in this supposedly black box to increase the accuracy of the prediction. Then for false negatives, the second limitation, we can actually include a doctor to oversee the entire process of the prediction. That way, a deeper analysis can occur, specifically for the data of strokes, and also in general, how can we avoid these false negatives? Then third, for the black box, there are two kind of options that we can consider. One being a decision algorithm, and that is kind of like a map where all the possible decisions from the neural network are displayed, and that is can significantly improve the accuracy of your final interpretation. And second option are saliency maps, and they kind of allow us to see where the neural network systems target specifically on brain scans or images. And that way we can see if they're targeting the correct regions. If they are, that's good. But if they're not, we can then change, and this hopefully will lead to, again, more accurate predictions on strokes.
As seen in our presentation, there are many ethical concerns with predictive AI. There are false positives and false negatives, which could lead to unfair unemployment and failed diagnoses. And the fact that privacy is such a major concern is just a whole new wormhole. But we have provided many solutions to combat these negatives. The most important takeaway of our presentation today is the fact that predictive AI, and in this case, enhanced neural networks, can lead to many benefits for individuals and the people around them. It can reduce the long-term impacts, the debilitating impacts of stroke, such as speech impairment and paralysis. In a sense, neural networks used for prediction is one small step for man, but a giant leap for the future of medicine. And however, with great responsibility comes great power, and we cannot let these artificial intelligence override our humans in society. And because of this, we still need more testing, more evidence, more experiments, and more clinical trials for this topic, as it is not an accessory, but rather a necessity. Thank you.
Great. Excellent presentation. I think this, the concept of predictive technologies it's an area of interest for me. I think it's underappreciated broadly in the public consciousness. I mean, you hear about it, but like these concerns, the specific concerns that you raise are sort of not highlighted enough. And I think it's great that you're bringing attention to it. I think I really like the way that you emphasized that there's a possibility of a disparate burden falling on certain populations based on, the burden of false positives and false negatives, right? Could affect different populations differently. And that's something that needs to be thought about at the forefront, right? As these technologies, not later, like now, like as they're being conceptualized and designed, because it may be hard later to go back and completely change the algorithm, or to to take back what's already put out there, right? So I think that's a powerful point that you made. It's interesting. I like the idea, people may argue this point, but I am partial to your solution of more like MD oversight as these technologies are rolled out. I think that it's a good practice. I mean, maybe it's a little less dramatic of an impact on our society. Society. People want to see these things do everything right from start to finish and be kind of autonomous. Like that's the vision. And I like the idea of an intermediate kind of step where these are developed as tools for people sitting in control. I'm partial to that. People will maybe argue that point, but I think that is a very I think that solution makes sense to me as a doctor, but maybe that's just me. But I like that for a number of reasons, because then when the ethical issues are there, right there, the onus still falls on a person who has to make decisions. And then you have to really think about how are those people trained, educated about the potential, issues as well. But I think it's a good solution.
Excellent job. Really clearly presented. I love the way that you thought through the effects on clinical care. You thought through the effects on the system as at large, and really looked at what the impacts might be on individuals in terms of unequal burdens of this. Drawing out the analogy between a seizure diagnosis and being considered at high risk of stroke, I thought was a really good point, and really highlights what some of the dangers are of using these technologies. And of course, you also focused on the potentially unequal predictability in different populations of people. And so the importance of needing to have the research in place to be able to really assess what are the rates of false positives, are there unequal rates of diagnosis of high risk, and establishing that before it goes into practice is going to be very important. So good job.
Agreed. And a couple of other things caught my eye for, really so many things in this with the implementation of AI. You were right to point out false negatives. You were right to point out false positives. More interestingly, you connected the dots between why it is going to be difficult to figure out when there are false negatives and false positives. Because in a weird sort of way, it's not like the training of the AI on scans happens first, then confidence level, goes up. Then we just implement it on a, cohort population. The whole thing is a clinical trial. It's all clinical trial. It's going to have human beings in the middle of it making decisions about the salience and, treatment plans and these sorts of things. It's not just going to be the AI. So the question is, when did the training stop and putting people into clinical trials, applying this? It's all blurred together. And that came through in this analysis. So that was one thing I really appreciated.
Yeah, you guys did a great job. I mean, I think one of the take-home messages that is implicit, and I would emphasize should be explicit to what you've done, is that problematic clinical issues, in other words, things that are very, very difficult, particularly to predict, probably would require some kind of heroic or Herculean solution, or at least an address. And, we're kind of stepping in fetching as to where we should begin to use some of this AI in medicine, or should we? But I think in those areas where it has the most viable good in terms of being head things off at the pass, so to speak, and that's what you're really getting at here. Because once somebody begins to have the stroke in evolution, it becomes very, very difficult, and in some cases impossible, to interrupt that neurological damage being done. You can mitigate certain things, but not others. So the idea of being able to prevent certain things, in other words, working further uprange, so to speak, becomes far more viable to implement health promotions and preventive medicine rather than interventional and recuperative medicine. And I think that's where a lot of these neural networks and decision technologies come in. A point that actually was pretty well made in a paper written years ago by Dr. Rossi, before he was Dr. Rossi. It was a great paper. So congratulations, you did a wonderful job, nicely handled. Don't ever worry if you pucker a little bit on stage. Everybody does it. Just keep right on going. You did a great job of recovery. So applause to each and all of you. Good job.